Abuse victims can be found anywhere, so it's important to always be aware of signs of abuse so that you can help those suffering from it. Those who work in the healthcare, law enforcement, or education fields must particularly be prepared to watch for signs of abuse in all patients, clients, or students. As this is a very sensitive subject, it is vital to not approach anyone in an accusatory manner. Victims will often try to reach out to others for help, although may be too scared to speak openly about their abuse. Listen, be supportive, and make sure the victim gets professional help immediately. In this lesson, we will discuss the types of abuse and their indicators, as well as how to respond to suspected abuse incidents.
Preview.
Symptoms of child abuse to look out for include unexplained injuries beyond injuries acquired from normal play, suspicious injuries like those that have a peculiar pattern, such as in a straight line or a circle, or in areas of the body that are generally protected, such as the inside of the arms or legs, the back, or the buttocks. The explanation for the injury may also be suspicious, or it may even change when asked again. Drastic changes in behavior, eating habits, or school performance. A child who seems to fear going home. Medical or dental problems that are continually left untreated. A child who seems to lack a certain level of personal care or hygiene. And a child who has trouble walking or sitting may be exhibiting signs of sexual abuse. Although many injuries can have other sources beyond domestic violence, some injuries are common among victims, and in combination with other suspicious behavior, can be an indicator of abuse. The most common injuries among victims of domestic abuse are a ruptured eardrum, a rectal or genital injury, cuts, scrapes, or bruises anywhere on the body, broken or loose teeth, cigarette burns, or bite marks. Domestic violence victims are generally afraid of getting help for their situation. If you try to approach a suspected victim, make sure it is somewhere they feel is private and safe. If you do not feel comfortable approaching them, report the case to the proper support center and a professional will address the situation. Signs of elder abuse are the same as possible signs of domestic violence, but abuse may also be manifested by inappropriate use of drugs or chemical restraints, financial exploitation, or the unauthorized use of an elderly person's funds or property can be a common sign of elder abuse, and the perpetrator is usually somebody that the victim is close to. And emotional abuse, which may be in verbal forms, such as yelling, intimidation, humiliation, and ridicule, or nonverbal forms such as ignoring or isolating. Elder abuse is generally the least reported type of abuse. If you see any indicators of elder abuse, do not assume that the abuse is already being handled. All victims deserve a life free of abuse, and you may be the only witness who can get them help. All healthcare workers, educators, law enforcement officers, and childcare workers are mandated reporters when it comes to abuse. If you suspect abuse, you must either call local child protective services or social services. When reporting, you should have as much information as possible on hand, including a description of all injuries and dates you noticed them, the identities of any suspected abusers, as many details of physical evidence as possible, the current condition and location of the victim, and a statement from the victim if possible. Additional resources are available to victims of domestic violence at the National Domestic Violence Hotline at 800-799-7233. You can call on behalf of a victim or encourage a victim to call themselves. In conclusion, healthcare, education, and law enforcement workers must always stay alert and watchful for signs of abuse, as well as being knowledgeable of the proper authorities to contact in case abuse is suspected. Anyone can help a suspected victim of abuse. Getting the proper support can be life-changing to a victim of abuse. You never know when attention to small details may even help save somebody's life. If you have any questions about your responsibility to report suspected abuse, please speak with your supervisor. I'm Olivia, your safety trainer, reminding you to be careful and stay safe out there. Thanks for watching.
If you like this video, please follow us on social media for OSHA updates, free safety webinars, reminders on safety tips, tricks, techniques, and more. What are you waiting for? Like, follow, or subscribe today. Remember to stay safe out there.